السلام ورحمة الله.
وعليكم السلام سير.
وعليكم السلام.
وعليكم السلام سلام.
How are you guys?
الحمد لله سير.
All good.
Okay, today inshallah we will practice procedural skills. So we have two stations for procedural skills and two stations for supervision and teaching. So this category, 4 stations in the exam. So very, very important. Okay. You will find procedural skills or supervision and teaching. All of them most likely teaching also. You will teach a procedure or you will teach ECG or teach ABG or teach X-ray. Maybe you will find mannequin. Maybe you will find junior doctor. Maybe you will find a junior nurse. Maybe you will find junior doctor and mannequin and actor as patient. Okay, so anyway, you should follow the general approach of teaching. What is the general approach of teaching? You can fix this in any procedure or in any teaching. You will introduce yourself same as any introduction. Good morning, I am Dr. blah 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 blah, one of the ED senior. May I know your name and grade? Nice to meet you. I believe you have something to discuss with me, and then mention the topic. Then ask 2 questions, separate questions, and you should stop after each question. The first question, how much do you know so far about this topic? And stop. The second question, anything specific you want to know? After that, you will stop. Okay, guys? So, how much do you know so far about this topic? The second question, anything specific you want to know? Okay. If the actor said nothing specific, here you have to set learning objectives. If the actor said nothing specific, here you as candidate, as doctor, you have to set learning objectives. So you can tell him, okay, today I will set learning objectives for you. I will teach you blah, 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 blah. So mention the name of the topic first, then divide the station into 3 parts. Divide the station into 3 parts. Before, during, and after. Before, during, and after. Before, it means indication, contraindications, complication, how to avoid the complication, how to treat the complications, alternatives if available or applicable. Then during it means preparation and technique. Then you will go for after. After it means post-procedure management. So this applicable in any station for procedures or teaching? No. 95% of stations. If you find the station is procedure, you will follow this approach. But ECG interpretation, it's not procedure. So you have different approach. We will tell you about that. ABG interpretation, it's not procedure. So you will follow different approach. Okay. So if you find the station is procedure, you will follow the same approach. Clear until here, guys?
Yes, sir.
Okay.
It's clear.
Actually, I received many messages from doctors who did not get a slot or seat. I know this is frustrating for most people because they are waiting for chance to get exam and then travel to the UK or whatever, even they are not planning to travel, but at least they want to pass their OSCE. That's why I'm always advising people to apply very early. Why? Because if at least if you did not get a chance for this diet, at least you can apply for the next diet. Some doctors they will plan for 1 year later. Why? If you will plan for after 1 year, you finished your exam, for example, intermediate or whatever. So why you will apply after 1 year? After 1 year, maybe you will not find a chance. So once you finished your exam, try to apply early. In any diet, try to apply early. Okay. Yes, they have priority for GMC registration or NHS contract or anything like that. But also they are considering applying early. So they are comparing people who are in NHS, they are the priority for who apply early. Yes, the priority for GMC, but for example, if two doctors they have GMC registration, which one will be approved? The one who applied early, and so on. Okay. So anyway, um, try to do your best. Focus now on practice. This is the most important. So at least to be ready for any exam. Okay, for new members, the structure is 16 stations. Okay, so procedural skills, 2 stations, and supervise and teach 2 stations. So total 4 stations. The most important domain, clinical reason decision making, means the management plan. So the management plan in all stations, whatever history or examination or even procedures. Communication skills, your attitude inside the room, inside the station, the way you are talking. So good eye contact, rapport, empathy, and also if you are giving information in pieces with pausing, if you are asking questions, so in pieces and with pausing as well, and try to check understanding and so on. The third important domain, organization, prioritization skills. You should be organized. And of course, if you are familiar with the general approach, and then you can be organized. Already we finished the history taking stations, psychiatry toxicology stations, resuscitation we finished, ALS, ATLS, and pediatric. Today we will start practical skills, and we will try to make in 2 sessions or maximum 3 sessions, system 1 session, joint 1 session, communication skills 2 or maximum 3 sessions. Okay. We almost finished 40 batches online and face-to-face. Again, we will do sessions for June and July teaching. After teaching sessions, we will go for mock exams for June only. After exam of June, we will go for July mock exams. Doctors for September, December, or next year, you can attend as a listener. Okay. I need to ask people who got a slot or seat, text me in private so we can make a special group for active practice. Okay. So you can text me in private, but after the session, don't disturb me now. Okay. Accuracy is the most important domain, so it means the checklist. Skillfulness, it means you should be fluent. Supportiveness, it means good communication skills, your attitude inside the room or inside the station. Efficiency, structure, organized, and safety, you should cover the safety points. We have for practice today Ikra, Amin, Sima, Marwan, Fatima, Mona, Safwan. If anyone interested to practice, you can raise your hand, please. So again, you have to divide the station into three parts: pre, during, and post. So again, the general approach, same introduction, good morning, and blah, blah, blah. What if you find two actors? You are not familiar with procedures, and you find two actors inside the room. No problem. Introduce yourself to this one and then to this one. Okay. If you find any procedure like suturing, for example, and you find the nurse and actor as patient, so the nurse here not for teaching. If you did not find the teaching in the pie chart, don't follow the approach of teaching. So just introduce yourself to the nurse and ignore her. Okay, don't follow the approach of teaching. Okay, so I will repeat the approach of teaching again. Good morning, I'm Dr. blah 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 blah, one of the ED senior. So I believe, may I know your name and grade? Nice to meet you, Robert. I believe you have something to discuss with me regarding blah blah blah. Mention the topic. Then, excellent, nice topic. Ask two questions. How much do you know so far about this topic? The second open question, anything specific you want to know? Okay. Today I will set learning objectives for you. I will teach you blah blah blah. Mention the name of the topic, then indication, contraindication, complication, how to prevent and treat complication, alternatives if applicable. Then during. During here preparation. What does it mean preparation, guys? 3 points. It means preparation for the doctor. You means wash our hands with PPE. Preparation of the patient, I mean the actor or the mannequin. So it means preparation of the position and the area. For example, you are doing arterial cannulation. Okay, so you will prepare the patient in lying position and the rest in dorsiflex position. If you are doing chest drain, so the patient lying flat, supine, and his hand behind his head. So preparation here, it means preparation of the candidate, the doctor, preparation of the mannequin or the patient or the actor, preparation of the equipment between the doctor and the patient. So 3 points. Then procedure, it means the steps. Don't jump to the steps. So you have introduction, indication, contraindication, complication, blah, blah, blah. So don't jump to the procedure. Procedure here, number 6. Okay. After that, post-procedure management. So dispose all sharp needles and sharp pen, other equipment in yellow box, and you will give the patient a printed leaflet. And also, if the patient for admission, you will admit, you will give advice as well. You will document all the procedure. Clear until here, guys?
Yes.
Okay. Sometimes they will ask you to um, do resuscitation, for example, procedure for basing or procedure for um, defibrillation, okay, or procedure for intubation. Intubation, it could be in peri-arrest, I mean the patient is alive, or intubation with the patient is in cardiac arrest. So whatever, you should follow the same approach of resuscitation. So it's not teaching. It's not teaching. Okay. One of the most important stations, so we have basic airway, whatever teaching or do intubation in advanced airway. So once we go during stations, I will tell you if this is very common or not common. Okay, if very important or not very important. Okay. Nerve block, you will follow also a general approach of teaching. So we will divide the station into three parts as well. Teaching we will do after procedures. Okay, we will start by Ikra.
Hello, Dr. Hani.
How are you? So if you
I'm
find
good.
if you find in the pie chart the teaching and practical skills, it means you will teach procedure. If you did not find teaching, don't teach. Don't follow the approach of teaching. Okay. So here, the task also teaching here and check the scenario. Teaching what? Adult basic airway management. Okay. So don't teach advanced airway management. Only the basics. Okay. You will go inside the room. Ikra.
Yeah,
You will go inside the room. You,
okay.
you will find a nurse or junior doctor. You will find all equipment and the mannequin. Okay.
Okay.
So you will do teaching for basic airway maneuver. You have 30 seconds and then 6 minutes. Okay, you can start.
Hello, good morning. I'm Dr. Ikra, one of the ED doctor. May I confirm your name and grade, please? Nice to meet you. I believe you have something to discuss with me regarding adult basic airway management. Is that right? Okay. It's a really important practical skills in ER. So can you tell me what do you know so far about adult basic airway management? Okay. And anything specific you want to learn? Okay, so let's set our learning object first. Okay, today I will teach you about the equipments we needed in the adult basic airway management, and then I will teach you about the response according to the response of the patient, then the scene safety, and then the airway opening maneuvers, and then airway adjacents to maintain the open airway, and then oxygen reservoir. Okay, and in the end I will give you some websites and videos that will teach you more. So follow me and follow me and uh, hello follow me and uh, let's go to the equipments first. Okay, and we need airway trolley, pillow, different sizes of oropharyngeal airway, nasopharyngeal airway, bag valve mask, oxygen reservoir, and suctioning devices, and non-breathable mask. Okay, let's start with first of all we'll check the scene safety first. Okay, and then the response of the patient. Okay, and if the patient is responding or if patient is not responding, uh, are you with me? Okay, then afterward if the patient is not responding, then we will check the pulse of the patient. If there is pulse, then we will try to open the airway, and if there is no pulse, and then we will go according to the ALS algorithm. Okay, then we will then if patient is not responding and there is pulse, we will try to open the airway, and there are two maneuvers. One is head tilt and chin lift. okay, and if there is a trauma patient, then we will jaw thrush. Are you following me? Okay. Uh, then after that, we will try to open the airway and see if there is any secretions or vomiters or in foreign body. Okay, then we will do a fine catheter to remove any secretions. For any vomiters, we will use rigid catheter, and for any foreign body, we will use Meglis forceps. Okay, are you with me? Okay. So after removing the suction, we will use airway adjacents to maintain the airway. We have a oropharyngeal airway. So do you know how we measure the oropharyngeal airway? Fantastic. We will measure from the mid incisors to the angle of the mandible, and we will try to insert ups and down, and then when it's touched to the hard palate, we will retort at 180-degree. Okay. And in children, we don't do this in this way, because and we put oropharyngeal airway by tongue depressor. Okay. And the indication of oropharyngeal airway is patient is not having gag reflex during suction. Okay. And are you with me? Are you following me? Okay. Then comes to the nasopharyngeal airway. How we can size it? We can size it from the lateral nostrils to the ipsilateral tragus of the air. Okay, and we will insert it. After sizing, we will insert it perpendicular to the face. Okay, and then we will apply the oxygen reservoirs, and for oxygen supply, we have nasopharyngeal, we have non-rebreather masks and the bag wall mask. The indication of non-rebreather masks are all ATLS, ALS, all patients who need oxygen. Okay, and the indication of bag wall mask are if the patient is having respiratory rate less than 12, if we are preparing for a patient to the intubation, and if patient respiration SpO2 is less than 94 at high flow oxygen. Are you following me? Okay. Are you with me? Okay. Then how can we there are two techniques for bag wall mask. One is 1% technique, and if it's failed, then we will go for the 2% technique. 1% in 1% technique, we will form a C on with our thumb and index finger around the cup, and then with other fingers we will do the jaw thrush. And if there is no chest ride, we will go for a 2% technique, and in this way, one person will hold the cup and the other person will do ambo bagging. Okay. Then after that, if patient is fail there is failure of two nasopharyngeal airway and one time oropharyngeal airway, then we will consider the repositioning of the head in trauma patient, and if it also fail, then we will go for LMA. And if it's failed, then we will go for some advanced airways and surgical airways. Are you with me? Are you following me?
Thank you.
Okay. And after that,
Well done. Thank you.
okay.
Okay. Thank you, Ikra. What do you think, guys? How many marks for Ikra?
Eight.
Okay. What is your comment on the feedback?
Not organized, otherwise completed all aspect.
Okay.
She need to pause and slow down.
You mean she's rushing in time?
Yeah, she need to
Looking
stop
pause.
and ask. And ask.
We can
I
feel
under-
she's takibnik. Okay.
She's looking for the brain.
Okay. So she did very well, but I want to from you, Ikra, to be
Yeah.
calm, very calm. Okay. In teaching, you have to be not slow, but at least not fast. Okay. Because
Okay.
teaching, you have to give information in pieces. Here are the learning objectives. you will talk about number one, safety, number two, response of the patient, number three, opening airway maneuver, number four, maintaining the airway open, and then you will go for clearing the airway. After that, you will go for the source of oxygen. Okay, so here you did very well. So you can verbalize the same introduction. Okay, good morning. I'm Dr. Bella. May I know your name and the grade? Nice to meet you. I believe you have something to discuss with me regarding adult basic airway management. Is that right? Yes. Nice topic. Excellent. How much do you know so far about adult basic airway management? Anything specific you want to know? Okay, today I will teach you I will teach you the learning. I will set learning objectives for you. Today, I will teach you adult basic airway management. I will teach you number one, the safety. Number two, the response. Number three, opening airway maneuver. Number four, maintaining airway open. And then clearing the airway and then the source of oxygen. Is that okay with you? Okay. Can you see? I'm calm or not?
Yes.
So don't, if you rush in time, you will be tachypneic, you will not concentrate. Okay? So try to be calm. And if you want to be fast, no problem, but don't rush in time. Okay. So number one, the safety. Check the safety of the patient and safety for you. Done. The response. Check the shoulders of the patient to check the response. If he is not responding, then look, listen, and feel. You have two options. No pulse, follow ALS algorithm or BLS algorithm. If the patient has pulse, then go for airway. Done. Then after that, opening airway maneuver. You have two ways. You did that. Head tilt, chin lift, jaw thrust. And do, in the exam, do that. Then you can go for, if the patient has trauma, so contraindicated to do that. So you will do jaw thrust. Okay. Then you will go for maintaining airway. You have two options, oropharyngeal airway, nasopharyngeal airway. Here you will comment on how to size, how to insert, when to insert. Easy.
Okay.
How to size, how to insert, when to insert. I mean indication. Okay. So this is how to be organized. How to be organized. So oropharyngeal airway from, so here when you are teaching, you will go for the opening airway maneuver, head tilt, chin lift, okay? And if the patient has trauma, jaw thrust. So head tilt in the exam, when you are teaching, you have to do. So one hand to push the forehead down, one hand to elevate the chin, okay? And jaw thrust, you will put two thumbs on the mid face and other fingers, whatever, one or two or three, it's not a big issue. You will elevate the mandible. Okay. Then you can clear the airway. Clearing the airway, if you want to clear after opening airway, okay. If you want to clear after oropharyngeal airway, okay also. It's up to you, no problem. Okay. So if the patient can open his airway without spasm, without clenching the teeth, so you can clean before airway maintenance. I mean without oropharyngeal or nasopharyngeal. If the patient is clenching his teeth, you cannot clean. That's why you have to insert oropharyngeal and nasopharyngeal. Then you can clean from the nose and from the oropharyngeal. Okay, so it's not a big issue. So here, once you reach clearing the airway, so you have fine suction for secretion and the rigid suction for vomiting and the magle forceps for foreign bodies. Then you will maintain the airway open. How? Oropharyngeal, nasopharyngeal. Again, you will comment on 3 points. How to size, how to insert, when to insert. How to size from midpoint incisor to angle of mandible. In adult, you will insert upside down side and then it will reach and touch the hard palate, then you can rotate 180 degrees. In pediatric, you can insert directly without rotation. Regarding the nasopharyngeal, from lateral edge of nostril to the tragus of the ear, and then you will insert perpendicular your target tragus of the ear. Okay, so it will be perpendicular on the face. And you will insert lateral, so you will not hurt the nasal septum. Okay, so it needs also lubricant. So when to insert or the indication. So here for oropharyngeal, if the patient has no gag reflex, and in such a case, it means the patient needs intubation. Regarding nasopharyngeal, if the patient conscious or semi-conscious or unconscious. So in any case, no problem. Okay, then you will go for source of oxygen. You have 2 sources, non-rebreather mask with high flow oxygen, and you have back valve mask. In any life-threatening condition, you would use non-rebreather mask with back reservoir. In case the patient cannot maintain oxygen saturation 94 to 98, you can use back valve mask, or if the RR less than 12, so you can use back valve mask. You can use 1-person technique, C and D, like that, one hand, and you will put the mask like that. In the exam, you have to put the mask on the mannequin, and you will do inflation by your hand. And then check chest rise. If no chest rise, it means failed, so you have to do 2-person technique. It means C and E, but this time 2-person technique. So I will hold the mask like that. So also head tiltation left. Don't forget head tiltation left. And you will ask the nurse, can you do inflation for me, please? And I will check the chest rise. Sometimes in the exam, no chest rise because the mannequin with no option of chest rise. So no problem. Don't wait for chest rise in the exam. Just verbalize. Okay. So I will give you 7 marks, Ikra, okay? Okay. Tamil?
Yes, sir.
Okay. So next station. Okay. This time you will do intubation, but the patient is alive, okay?
Okay, sir.
So your task to do rapid sequence induction. So here you will do pre-oxygenation for 5 minutes. Then you will follow 3 attempts of plan A. And then if failed, the first attempt, you have to go for pre-oxygenation again for 5 minutes. Okay. So at any time you will do intubation, you have to wait for 5 minutes pre-oxygenation. Clear?
Okay, sir.
Okay. So plan A, 3 attempts. Plan B, you will go for 2 attempts for supraglottic airway device, or 1 attempt, it's not a big issue. Plan C, it means back valve mask only. Okay. So here, if the patient has indication to intubate, so you will call anesthetist and you will prepare. So in primary assessment, don't intubate. You will do intubation in the secondary assessment, right?
Yes, sir.
In the primary assessment, you will do pre-oxygenation for 5 minutes. Within 5 minutes, you will finish airway, breathing, circulation, disability, exposure, and so on, right?
Okay, sir.
Yes. So here regarding pre-oxygenation. In pre-oxygenation, don't rush in time. So you have time to prepare difficulty airway thoroughly and mention the equipment by name. So for example, 2 laryngoscopes, 2 AT tubes, and also you will mention 2 oropharyngeal airway, nasopharyngeal airway, and a styled bougie, also anything you need for difficult airway thoroughly. Okay, so you will do back valve mask only. Okay, and back valve mask, how to know it's successful or not? Already in B, in breathing, you will ask about the 8 points, right?
Yes, sir.
You have only 3 points important to check success of back valve mask or intubation. Number 1, oxygen saturation. Number 2, bilateral chest rise. Number 3, EtCO2, right? Already
Yes, sir.
you can get them in breathing assessment. Okay. So after you go for breathing, if you find accepted, you can keep the back valve mask and then go for circulation. In circulation, you have to follow the assessment and prepare circulation equipment. I mean medication, because rapid sequence inductions, it means you should prepare induction agent. You have triad, anesthetic triad. Number 1, induction agent. Number 2, muscle relaxant. Number 3, analgesic, right?
Yes, sir.
Okay. So the induction agent, you can use whatever, propofol, ketamine, etomidate, or thiopentol. It depends on the station. For example, anaphylaxis, you can use propofol, no problem. Okay. You can use also fentanyl if the patient has RR accepted. You can use muscle relaxant, so procuronium or any or suxamazone. Okay. So you will prepare equipment in circulation, but don't give in primary assessment. So just prepare airway equipment in first A. You will prepare circulation equipment in first C. Is it clear?
Yes, sir.
But you will intubate in second A if the patient is still his airway compromised. Okay. You will give induction agent. You will give induction agent in the second C. Okay.
Okay, sir.
So here regarding intubation, what you will do? Number one, you will give, you will do cricoid pressure. You will do cricoid pressure. Okay. You will give the induction agent, and then you will, after 1 minute, you will insert a laryngoscope. You will insert a laryngoscope. Okay. And then you will see the vocal cords. You will insert the tube. After that, you will inflate the cuff, and then you will check success. Okay. If N, so you will release the cricoid pressure. Clear now? So
Okay, sir.
cricoid pressure before induction agent, and they will release after intubation. I think it's clear. So the
Okay.
process of intubation, the process of giving medication should start by cricoid pressure and end by releasing cricoid pressure. I wish it's clear.
Okay, sir.
Okay, so here, if the patient has anaphylaxis, of course, you have to give the patient adrenaline. Okay, your task to do rapid sequence induction. So you have to mentioned that in the introduction as well. Okay. Okay. So at any time the tube is out, how to know that? No bilateral chest rise, oxygen saturation is not reading, ATCO2 is not reading, or anything abnormal. So you should verbalize the tube is gastric. I mean out, or you can say out. Okay. So here what you will do, deflate the cuff, remove the tube, connect back valve mask, pre-oxygenation for, or you can say re-oxygenation for further 5 minutes. Easy.
Okay, sir.
And then you will say 5 minutes passed, I will re-intubate again. Like that, clear? And
Okay, sir.
every time you have to call anesthetist also. Okay. When you try to re-intubate, you can verbalize, I will clear the airway, I will change the laryngoscope, I will change the tube, and so on. Okay? You have 30 seconds and 6 minutes. Okay, you can start.
Okay, sir. Hi, I'm Dr. Tamil. I'm the ED registrar. May I know your name and level, please? Okay, nice to meet both of you. Both of you are ALS providers. So today we are expecting a 39-year-old patient about to arrive soon, probably having anaphylaxis. Nurse A, are you happy to manage the airway? So please check and prepare all the airway equipments, including the difficult airway trolley, and prepare all the equipment for rapid sequence of intubation, because this patient might need an intubation and we might expect a difficult intubation. So Nurse B, are you happy to manage the circulation? Please check and prepare all the circulation equipment, including the resuscitation drugs, fluids, cannula, and all the monitors. And for the for equipment for intubation, please prepare a Yonko suction, 2 laryngoscope in case one fails, a syringe to inflate the tube cuff, a tube tie, a boogie, stylet, and then a tubing for capnography.
Patient arrived.
Okay. Hello, sir. I'm Dr. Tamil. How can I help you? Any response? Is the patient talking?
The patient has a stridor and hoarseness of voice. He cannot talk.
Okay. Is the airway patent? Okay, let's open the mouth and let's do a look, listen, and feel. And then, okay, there's a stridor and there's a hoarseness of voice. Is there any tongue swelling or any foreign body? Okay, so let's insert a nasopharyngeal airway. Please size it correctly from the lateral edge of the nose to the tragus. Lubricate it and insert it. And let's put the patient on a high flow mask oxygen with a reservoir, 15 liters per minute. Please call the anesthetist. This patient has anaphylaxis and needs a rapid sequence at intubation. And nurse, please give adrenaline 0.5 milligram intramuscularly at the anterior part of the thigh. And please prepare all the airway equipment for intubation and difficult airway trolley. So let's move on to breathing. Please expose the chest and connect to the monitors. Is the trachea central?
Trachea central.
How about, okay, the neck veins are normal?
Normal.
How about the respiratory rate?
RR is 40.
Oxygen saturation?
Saturation is 9.4.
Okay, how about the inspection of the chest? Is there any rashes, scars, deformity? Okay, what about the palpation of the chest or the chest expansion?
Normal.
The percussion, okay, the percussion of the chest?
Normal.
Okay, auscultations of the chest?
Normal.
Normal. Okay, how about the heart sounds?
Normal.
Okay, so I'm happy with the breathing. I will move on to circulation. Okay, what about the blood pressure,
Blood pressure normal.
pulse rate,
Normal.
capillary filling test?
Normal.
Okay, how about the okay, so let's insert the 2 large bore cannula and then extract blood for hematology, biochemistry, blood gas, toxicology, blood culture, and a mast cell tryptase. And let's give a fluid challenge of 500 ml of normal saline bolus. And let's prepare the medications for the rapid sequence of intubation. Let's prepare intravenous propofol 1 milligram per kg, IV rocuronium 0.6 milligram per kg, and IV fentanyl 1 microgram per kg. Is the anesthetist has arrived? Okay, let's go to the deformity. Okay, how about the GCS of the patient?
15.
15. Okay, let's go to the exposure. What about the temperature?
Normal.
Okay, any rashes while exposing the patient?
Normal.
Okay. Okay, so have we pre-oxygenated the patient for 5 minutes? Okay, as the anesthetist has arrived? Okay, I think I will intubate the patient. So can we please give the patient cricot pressure, and then let's administer all the induction agent. Okay, and then we'll wait for 1 minute, okay, for the muscle relaxant to work. And then let's intubate the patient. Once we have visualized the vocal cord, insert the ETT. And then once we have inserted the endotracheal tube, we have to correctly verify the placement of the endotracheal tube by looking at the oxygen saturation and tidal CO2 and the equal chest rise. So what about the chest rise? Is there equal chest rise?
Yes.
Okay, what about the oxygen saturation?
Saturation is not reading.
Not reading. How about the end tidal CO2? Is it normal?
Not reading.
Okay, is the anesthetist has arrived? Okay, I think the anesthetist has not arrived, so I will deflate the cuff and I will remove the endotracheal tube. Let's pre-oxygenate the patient for another 5 minutes, and then I will reattempt again. And then continue to back valve mask for the 5 minutes. As the anesthetist has arrived.
Thank you.
Okay, so I'll move on.
Your timeline.
Okay. Okay, sir.
Okay, excellent. What do you think, guys? How many marks for timeline?
Seven.
6 or 7.
She did not reach the end of the task, right?
Yes, sir.
Okay. Anyway, in the exam, you will find the further 2 minutes. You might find the way. Okay, but you are explaining in details. Okay. You ask me about the airway. Is the airway patent? I told you hoarseness of voice and stridor. Okay. Why you will ask about large tongue and lips and so on. If I
Yes.
want to say that, I will mention, right?
Yes, sir.
So don't waste the time. Okay. Here you ask me about the inspection, any scar, any deformity. Why? What is your point? Why you ask about scars or deformity?
Okay, sir, I shouldn't have asked it.
Of course, you should not ask. Okay.
Mhm.
I want you to ask relevant questions.